recording. Thanks so much for agreeing to talk to us today. The mission of this project is to give a voice to unheard stories and to foster better communication between the healthcare world and the non-healthcare world. And, we want to hear about anything you want to talk about, basically any of your experiences, your thoughts about it. And so we want you to feel free to really talk about any topic. And we will get the ball rolling with just some really basic factual questions like, how old are you? How you got started in this field? Or how many years have you been in the healthcare business?
Sure. I'm 40 years old. I have been in healthcare for 20 years this month, actually.
Um, about 7 years. I'd like you to say I work in healthcare, if that's okay with you. Yeah, call me a healthcare worker. That'd be my preference.
I am 49 years old. I have been doing CNA, certified nurse assistant, work for about 20 plus years, and I have been in my current job at the hospital for 10 years. I assist the nurse. So I am someone that if you need to be fed, I help with that. I help with activities of daily life. I help with transferring you. I help with everything that the nurses doesn't have time for, where we balance off of each other.
So I've been a nurse for about 30 years, and it was something I wanted to do in high school. And it was kind of directed in a different direction by one of my parents, but then still had that calling or that yearning. So I did go to nurse. I didn't go to nursing school until I was about 27. I was a single mom of 3 kids. So I was a little bit older than my classmates and had a different purpose for going into nursing than a lot of my younger classmates, but it has been my calling.
I am 51. I started in the ICU. I've been in the same unit for 11 years. We are the abdominal transplant ICU, so we do liver and kidney transplants, sometimes a pancreas here and there, big abdominal surgeries, risky vascular surgeries, but our main populance is end-stage liver.
I am almost a month away exactly today from my 49th birthday. So I'm 48 still for a little bit longer. I have been in the healthcare industry all the way for a very long time. I actually started as an EMT when I was 17 years old.
Great, great. Well, even before you started in healthcare, how did you get into this?
Well, honestly, I've always wanted to be a nurse. That was my goal. I never wanted to do anything else. It was like I was put here to do this.
When I was about 16, my mom always worked at a Jewish Orthodox nursing home. I used to go there to volunteer at these synagogues, and I like spending time with the older people. And those people never had anyone to visit. Just being there and talking to them, I like older people. So if I can get paid to do something that I love, then I'll continue to do it. And I like what I do. I mean, sometimes it's hard. It's not always an easy job. Sometimes you do go to work. I love my job. I love my job when it's hard. But in the end, if you've been there for one person, you achieve what you set out to do.
Yeah. I became a CNA, and that was beautiful work because you're so in touch with the patients. You're actually hands-on helping them use the toilet, helping them get their medicines, changing wound bandages and such. However, the pay is abysmal. So I went back to school to be in healthcare, to be a nurse.
I grew up in a hospital, so to speak. Both my grandmothers worked in a hospital in different departments, but I really always had a love for people, patients, medicine, especially emergency medicine from a very young age. I just really wanted to grow up and be an ER nurse. And so I said, well, the natural track is to probably take the EMT basic and go from there. Maybe becoming a paramedic and work my way up to becoming a nurse. And that's exactly what I did.
I feel like I've always really enjoyed science and learning about the human body, how it works, and why things happen. But I had my first child when I was 20, And so I saved a little bit of money and I put myself through phlebotomy school, so drawing blood. So I did that for 7 years, and I just sort of felt a call to pursue more education, keep learning, and further myself in my career. And over the 20 years, I've been a CNA, I've worked in home health, I've worked in a doctor's office, and currently a registered nurse. And I work in labor and delivery at our hospital. But yeah, I feel like I've kind of had the whole gamut.
I went to nursing school right out of high school. I just couldn't pass my biochemistry class with an 80% to get credit for it. So I took that class as many times as they allowed, and it was the same professor and the same way of teaching, and it just didn't click with me. So I dropped out, and life just sort of got in the way, and you're working and you're having a family. I started back at community college part-time with anatomy and physiology, and then micro and biochemistry, which I aced everybody. I even tutored. So 3 years later, fast forward, I finally graduated in 2011. So I took a very roundabout way, but never lost sight of what I wanted to do.
I started out as med surg or in the medical surgical unit for about the first 10 years, and then about 10 years after that spent time in ambulatory surgery, and then spent a couple of years at the eye surgery center, which wasn't for me. And then I spent the last 6.5 years as a hospice nurse, which has been my true calling. I think the unique thing about hospice is that you either get it or you don't. You're either made for it or you're not, and it's pretty obvious right away if you're not made for it. It's kind of hard to explain, but it's extremely obvious to the patients and the families. Hospice nursing is just a different type of caring. It's a different type of compassion.
I was told that I don't think the right way to be a nurse. At one point from one professor, she was like, "You just don't think like us." And I was like, well, I come from a very different background, but I am more than sure that I can learn how to do this. And I didn't have a lot of sciences, right? I just did the bare minimum of science back in the day, a million years ago when I did those original degrees. And so to then do a degree that is 100% science was a culture shift and a big challenge. But hey, I passed my boards, so determination can take you far.
Right. So talk about how you entered the world of healthcare and, the first days there, obviously pre-COVID, right?
It was the scariest, most challenging thing for me ever, starting in the ICU. You think you kind of come out of school knowing something and you know nothing. It was probably the most challenging getting through orientation, which is typically 90 days for ICU. Some people need longer because coming off orientation when you're not prepared is scary. People's lives are in your hands. You practice on fake things in school, but it's not a real person, You actually have to make somebody uncomfortable while you're doing it.
I started out in a nursing home where they offered the CNA course, and then you had to stay for like a couple of years. I went there, and then I went to a hospital, and then I worked there for a long time, and then I started doing home care. Sometimes people do better in their own home. I'm just there to get them over that hump or to put them back to the way they were before, you went to the hospital, to give you a little help. And once you get that help or you're back at baseline, then, I'm out of there. I like going to homes, but that gets tiring. Driving to a lot of places, so I went back to the hospital.
I was an active paramedic on a volunteer rescue squad prior to starting nursing school. And then through about 3/4 of the way through nursing school, I was still an active paramedic and had a job in an emergency room as an ER tech. Something kind of had to give, and unfortunately, because being a paramedic at the time, I was a volunteer and I needed to pay the bills. So I gave up that volunteer paramedic time to complete nursing school.
Prior to COVID, the unit I worked on was the oncology medical surgical. So we get some of everything. I started at 6:30 in the morning, so I'm assessing vitals. Any abnormalities of those vitals, I report them to the nurse. Sometimes they have special diets where they have to be constantly, supervised and or fed. And I'm helping them with their bathing if necessary. I'm helping them with toiletrying. So that's my job. Sometimes, they just need someone to help them to get them safely from their beds to the chair to the bathroom and back.
I think if you do hospice, you do home care, but even those two types of nurses are totally different. You know, when you go into the home health part of it, you're going into that patient's home with the expectation that you're going to fix them, or you're going to heal them, or they're going to get better to go back onto their lives. Where in hospice, you know, going into that home, we have another objective. We know we can't fix it, we can't heal it, we can't cure what's going on, but we also know that every person on this earth is going to die. And so we're fortunate enough to be able to walk some of those patients until the very end.
Yeah, we generally work 3 12-hour shifts a week, which is considered full time, and you're expected to work every third weekend. So you may have 4 days off, but they're not usually all in a row. 12-hour shifts are they're not really 12 hours. You know, you leave your house at 6:30 in the morning and then you get home at 8 p.m. or later. And it's just, they're long days. 30-minute lunch, that is mandated, but actually sometimes you don't get lunch. Yeah, 30 minutes in 12 hours. It's grueling work sometimes, a lot of times. And it is a little bit true as you live through it over and over and over again. You do become a little jaded, or I don't like to use that word, but less emotional about death. But I do feel like I am less emotional in general, especially over the last couple of years.
One of the things that I found out that I was really kind of shocked about, and I still kind of feel like we're doing a huge disservice to our whole medical team, is that doctors don't learn about having a conversation about end of life. They don't learn about the actual dying process. They learn about the disease, but most doctors, and you know, I'm not finding fault with them or anything, it's just not taught. It's no wonder that these people are scared to death to die, because we as a society don't walk people through that. And if we leave it to the doctors who aren't educated, death is scary, you know? And it's, we're all gonna go through it, and it's a scary moment for each and one of us, but we need to humanize that end of life because it shouldn't be scary. We just have to let the patient tell us what they want and, you know, follow their wishes as best as we can. But educating everyone on walking people through those last stages, I think that's one of my strongest qualities, but also my most enduring and enjoyable one.
The biggest thing I can tell people is to make sure you know who you're making your power of attorney, and make sure they're able and willing to do what you want them to do, because not everybody can do that. You're not letting someone die, you're giving them a quality of life, and you're doing what they would have wanted. You're just carrying that out for them, and that's a big decision. That's a big responsibility for someone to make. It's kind of vague, when something like this strikes, and then the family says, well, I don't know what she would have wanted. So it's how to put it, in black and white. For me, I did that. I've done that, I think like 10 years ago, and I make sure that it's updated.
In the ICU, you have to make a point at the beginning of your stay to determine a goal of care. Are you willing to get intubated? Do you want chest compressions? A lot of times, especially in transplant, there are a lot of ethical and moral dilemmas that we as nurses have to deal with. What our personal feelings are, what the family's feelings are, what the patient's feelings are, and what the doctor's feelings are about how how much more do we put this person through? There does come a point where you feel like you're torturing them. Just receiving blood transfusions and other blood products, being poked a million times for labs multiple times a day, drains placed, CT scans, constant things being done to your body. It's got to feel like you're a scientific experiment. I'm actually surprised a lot of people push for it. And then there's the patients that are like, I'm done, please stop. But your family members aren't listening. They're not hearing them. So, yes, when my patients are passing now, I see it as a blessing sometimes. It's a pretty horrific disease process. Honestly, I would never wish it on even my worst enemy. There's a lot of push and pull of heartstrings. I don't know how else to, it's so hard to put into words.
Hmm. Yeah. Well, can you take us back to the first week when you first learned the term COVID, when the whole world basically went on to like alarm footing? What was that like that day or that week?
So I remember the first patient we had who was COVID positive in the ICU. And I think it was, oh gosh, March, maybe? Question mark. I'm not even sure. Nobody knew the severity of COVID yet. The hospital had pivoted to no visitors at all, none, period. This patient was dying. Patient was a full code, and we had to have a conversation with the family about code status because at this point, the patient was on so much oxygen and so many medicines to keep his blood pressure up. But basically, this patient's kidneys were failing from COVID and from the lack of functionality in his body. COVID was shutting down his body, and his family did not understand. They were begging us to do a lung transplant, and this patient was in his 80s, I believe, if I remember correctly, very old, wouldn't likely qualify for a transplant at that age anyway. And the family is arguing, and we have to call in an ethics consult, and then huge amounts of panels of people have to weigh in on what is ethical and what is right for a patient, and what is feasible as well. In talking about all of these things, trying to help families understand complicated medical terms that were going on with their loved ones. And when you talk about code status, people think you're giving up, right? They think, oh, you're giving up on my loved one. You're not going to do everything for them. When in reality, you have to talk to these distraught family members about the fact that their loved one's heart is going to fail. And we know this because we could see his vitals. We could see the trend over days, and we would never rush families. So we would never say, you have to choose this. We would just say, look, this is what's happening. We see physically what is happening with your mom, your dad, brother, uncle, sister, cousin. We know that they will die. So how do you want them to die? Essentially, do you want us to be pounding on their chest, shoving tubes down their throat and putting them on machines that would only possibly give them a few more hours, a few more days, and you can't come in and visit them anyway? Our biggest question was always, what would the patient want? If your mom was sitting here next to me, having this conversation about end of life and knowing that their heart was going to stop, what would they want?
I don't really even think we had a name for it. You really didn't think of what the long-term effects are or how serious it was, because at the time, there wasn't a lot known about it. When the respiratory status is getting really bad and you don't know how to fix that, when someone, can't breathe, you want to give them oxygen, you want to breathe for them. That's scary. You spend a lot of time trying to help them, and when you can't, we send them to the ICU. Now, we don't do that because every bed in the hospital is full. We're in overflow. They're really looking at surgery that can be like postponed, because what you see in the news as far as the nursing shortage, it's true. There are no beds anywhere.
I think it was just a day by day thing. Everyone, including the healthcare providers, were scared and were just nervous. And we all had our moments where, my gosh, it's just the flu. We've lived through an epidemic before. We'll get through this. And then, we kind of figured it out. Maybe it's not like the flu, just a different array of emotions every day.
Right. Yeah. Have you actually witnessed a significant reduction either in the ability for your system to actually reach every patient that needs it, or also in the quality of the assistance that patients get?
Absolutely. One of the things that we're finding now in this current surge is when the smaller hospitals receive somebody that was COVID positive or needed high flow oxygen, smaller hospitals were not equipped to handle that. So they immediately got shipped to the bigger hospitals. The nursing homes are overwhelmed. They are short staffed because a lot of their nurses went on traveling nurses or they have COVID. So they can't take the patients from the hospital. Now you have a patient that's lying there waiting for somewhere to go, and there's no one to take them, and the family can't take them home. It's not a safe environment. So there's a huge trickle effect that the public isn't seeing. They're not witnessing that. They're not understanding how this affects each and every person differently. I think a lot of the healthcare providers don't always get that either.
Can you describe how somebody actually dies of COVID? Like, what is it that is happening in their body?
This virus would get down in your lungs. It would cause what they call COVID pneumonia, and there was no coming back. They talked about the broken glass that they saw on the x-rays that was specific to COVID pneumonia. However, as we move farther into this pandemic, we're not seeing just the respiratory, but we're seeing people having active heart attacks, cardiac events. We saw people having strokes that were COVID positive. It was a huge assortment of ailments that these patients were coming in. We cannot pinpoint just one specific thing and cannot pinpoint the trajectory of every person's illness because we just didn't know. It was frightening because, again, you could not fix it. We would get the respiratory under control and get them on a BiPAP and be there for a couple of days. Then all of a sudden they have a stroke, or all of a sudden they have a cardiac event. We could not advocate the right care for that patient. That was at the beginning, and then we got to where we got better at the respiratory part of it. We found out that if you put the patient on steroids, that those are working, and then it became the standard of care.
Yeah, and then the biggest thing that was really sort of crazy or just unprecedented was all the nurses were told, you have one N95, put it in a paper bag and keep using it as much as you're able to. Then they added the face shields and then slowly added in all the rest of the PPE and that sort of thing. Things were shifting so quickly. And then the recommendations from the federal government were constantly changing. And then it became political, which was exhausting, right? Because science is not generally political. Your health is not political. The healthcare system that you would go to and trusted with your cancer and your grandma's heart disease and your uncle's diabetes suddenly became this terrible system where people were putting in COVID diagnoses, right? Like, they're making it up. They just want to make more money. Are you kidding me? No, we can't do that. That's called insurance fraud. Like, it's not even something. I can promise you that the healthcare system I was working in was not doing that.
Yeah, I think it's important to be open and raw and transparent because people need to know what it looks like. You know, the world can learn from this, if anything else, just how to be more kind to one another. When I was working in the main long-term care community as a hospice nurse, I had been in this community for several years already. I really had grown to call it family. Sometimes I was there more than I was home, honestly. And so I'm very comfortable in this community. So initially, when COVID snuck its way into this place, I think we were all in denial. There was a patient we'll refer to as patient 0. I told a nurse at the time that worked there regularly, I feared this could be COVID. And this was early on when we first found out about COVID, and they said, no, we don't think so. And I said, listen, I just don't have a good feeling. I think we should test. Sure enough, the patient came up COVID positive. And so that patient went into isolation and their family was notified, and that patient continued to decline very rapidly, became a hospice patient with another agency. And unfortunately, both of the hospice members for that agency required COVID as well, and started an absolute wildfire in the community of COVID. Inadvertently, obviously unintentionally. At the time, we were not familiar with what we were supposed to be wearing, mask-wise and gowns, and not having enough staff. It was very detrimental. So it was about 24 hours later, I came back to visit and noticed one of my patients appeared very ill. And I told the nurse, we need to test the patient. And sure enough, my patient came back COVID positive. They called the corporate, who runs the building, and they said, you have to test everyone. So at that point, I think I was there about 14 hours that day. I had at the time 9 patients in this building. There were only 28 patients total. So I stayed with the nurse and I tested all the residents, and I am horrified to report that 28 of those residents, 26 of them tested positive. It's just, I can't even convey the horror. I think we were in disbelief, and of my patients, all 9 of them were positive. All 9 of them got tremendously ill, and 8 of them passed away. And people say, well, you're a hospice nurse. Are you not used to the dying and death process? And it's not that. I used to tell people all the time, it's not that I don't understand what it looks like. Our days are numbered. I'm a person of great faith. I understand that we are set here with a purpose, and we have so many days. However, it was the manner in which people suffered. It was the isolation, and it was the very fact that regardless of everything that we could do, the result was still the same, and it was so quick. I think that was the worst part. There were no long goodbyes. Sometimes there were no goodbyes. And I think that hit me the hardest, where the loss was so great and so fast and in such great numbers in a short amount of time. With my 9 patients, they were all gone within a 12-day span. And I, in my human mind and in my frail heart, cannot. It almost doesn't make any sense. Was there something that we could do as healthcare providers to prevent this from happening once it was in the community? Could we prevent people from succumbing to this disease? We gave it everything that we had to try and battle it. But I think I was so overwhelmed that just the lack of control, where everything I knew as a nurse, everything I knew to do, everything I had done in the past had just fallen short and ultimately failed. And I knew it wasn't me. It was all of us. It was very hard to witness. It was very hard to live through. Some of the most difficult conversations I've ever had to have with family members at that time. And I just pray that we will never have to endure that sort of heartache again. And yet, here we are, still in the thick of it. There definitely has been a light at the end of the tunnel. And of those 28 patients, 3 of them did survive miraculously. Many things have changed. We have better availability of protective equipment, better medicine, better technology. But the loss was tremendously great, more than I had known in all my years.
Yeah, I feel like it's that JFK assassination, or when the towers fell, it's like, this is the time that happened. So I was on the floor at that time. I don't think that we were even wearing masks just yet. There was just all this hubbub, and you're trying to take care of patients at the same time. But I got a call after I got home that night that things were going to change. And so I got an email. It was a lot of information at once, but I just remember there was a bunch of stuff with the PPE. So at that time, we had to have our hair covered. We had to have a gown in every room. We had to wear the N95s every time we would go into a room. But at that time, we We kept them in paper bags, you know, known for their stealth blocking of germs. And I even see people are getting little tattoos of paper bags with their name written on it. Yeah, some things are very interesting. But I know I heard in other hospitals that they had completely cut off support people for the laboring woman. And where I live, it's actually illegal for a laboring woman not to be allowed a support person, no matter what the situation is. So our hospital and the other ones in town have always, through the pandemic at least, allowed one support person. I feel like that's unbelievably important for a woman going through labor, to just be able to have someone that she knows on a personal level walk alongside her during this time. Sometimes we don't like the policies either, but it's something that we're asked to enforce. In particular, I have a lot of dads that are refusing to put their masks on. We're like 2 years into this, guys. I don't know what your COVID status is. You are not my patient. I do not have access to your medical records. And I even tell them, it's not even about you and I passing it to each other. I have COVID patients on this floor. It is right down the hall, and it can be in and out of here, and you could take it home with your newborn child. That's the risk. I'm not saying always comply to everything, but at least ask questions until you feel comfortable. Just don't assume that we're out to get you.
Yeah, initially we had a lot of COVID, but I feel like there's way more suddenly. Like this Omicron is definitely more dominant. Our COVID ICU in my hospital has 24 beds, and they have been full of COVID. Full. And our ICUs are just overflowing with just sick patients in general. There's constant emergency room boarders. For example, 2 days ago, when I came in, there were 27 patients in the waiting room and 55 patients needing to be placed into beds. And that grew to like 78 patients in the waiting room by the time half of my day was done. And more patients still needing beds. I don't even know how to put it. There are patients that are dying in emergency room because they can't get the care they need. The emergency room is not meant to be used as overnighting. For multiple days in a row, they don't have the ability to see those patients and monitor them as closely as they need to be monitored. It's scary. So it really comes down to not just the actual virus, but being able to take care of people who have other illnesses that need to be taken care of. Massive heart attacks, strokes, people who need ICU care can't get it.
This round, we don't have that huge array of symptoms like we did. We're not seeing the stroke victims, we're not seeing the cardiac events. It's really the respiratory coming in with that cough and that fatigue this round. We're not seeing the loss of taste and the loss of smell like we did with the first round. So even though it's testing positive for COVID, it's obviously a different story.
Now everyone is short, and we're all short. I can say 5 days ago, maybe 6 days ago, we had 5 nurses call in for the night shift because they were all positive with COVID. We're doing an extra shift. So you get a day off between shifts, and then another couple shifts, and then a day off and another couple shifts. So it's getting weary.
Right. Yeah. How does being short-staffed affect the work that you do?
I do a lot more, with a lot more patients. We do what we have to do, to keep the patients safe, to try to make them happy, and to give them good care. So if that means, I'm working a little harder than I would always, then that's what you have to do. Because you have to believe that somebody would do the same for you if you were in it. No. The one thing I wish patients would realize sometimes, you're not the only one who has COVID. That's what I'm running into. Like, people are used to, when they put that call light on, someone being right there. Now it's going to take me a little while to get there because I have to, go be in another room. And again, I need to put on all this gear or to go into, your room. So, and patients don't care about that.
There were days where I was admitting 5 or 6 patients a day into inpatient hospice, and before I would even get my charting done, which the charting to do one inpatient hospice is about 2 to 3 hours. Before I could even get it done, that patient had passed away. So then it kind of got to the point where I'm getting the referrals and talking to the families about end of life. Yes, we can admit him to hospice, but your dad's gonna die before we can even get that done. So what can we do to just make him comfortable and go through the conversations without the additional hospice admission?
When you're that busy, how do you maintain some sense of connection? Like, how do you help patients feel more like patients and not like numbers?
Maybe the patient themselves couldn't tell me what they needed, and so I had to rely on family. Family would say, "Oh, she loves songs from the Beatles," and so I turn the Beatles on when I'm going to give this patient a bath, right? So, or I would sing, honestly. As a hospice volunteer, I've learned the songs that people wanted me to sing to their loved ones. Um, I like to try to help the patient find their voice or use their voice, tell their story, because a lot of times the healthcare system says, well, this is what's next. This is what's expected to be next in this protocol. Aren't you going to do it? Where often patients say, oh, actually, no, I have a completely different goal. Or I guess I have to do it because my doctors are telling me I have to do that. And nothing ill meant towards doctors who are recommending protocols, but a lot of patients don't have enough knowledge to say, wait a minute, I have a choice to say no, or let's just wait and see what could happen. So trying to encourage my colleagues to see patients as more than just their diagnosis or their disease, which most of them want to do. And just in the exhaustion of the field, sometimes we forget to do. So that's been sort of my own personal outreach.
Patients have rights, we have to inform you of what we're offering, why we're offering it, and what it will do. Like whenever a nurse comes in and has your medication, she doesn't just dump the pills in a cup. Every pill she explains, okay, this pill is for your blood pressure. Do you want it? This pill is for your heart. Do you want it? Patients can say no at any time.
A lot of my patients had some pretty significant cognitive deficits. There was definitely a lot more reassuring, and obviously, I'm not one to take away someone's hope. I'm a firm believer in hope. I think we have hope until we draw our last breath. Personally, I would reassure my patients, by my presence, especially if they weren't able to comprehend conversation like that. Just being present. And COVID has been so incredibly isolating to millions around the globe that just being there, showing up, I found was enough. I'm going to do anything within my physical capacity to make sure that their journey to the end of this is going to be as peaceful as I can possibly make it. A lot of praying, a lot of people clinging to faith, where maybe once they either denounced it perhaps, or just never really had it as a part of their life, would ask for prayer, would ask questions about eternity, would ask questions about God or whomever else. And that was a good opportunity to be able to let them know that they're not alone, not necessarily pushing everyone to go to the faith direction that you currently are in, but to give them a reason for my hope and then allow them to make their own decisions. Whatever direction they chose to journey into, just journey with them. Because as nurses, that's our lot.
Right. What is it that gives you at the end of a 14-hour shift, when you're sitting in your car about to go home, what is the thing that you can look at yourself and say, this was worth it?
Well, there are some days where you don't have anything specific that does that for you, but the days that it does is what keeps you going. The connection with your patients, In the ICU, you do have the opportunity to connect because your patients are there for months. I've taken care of patients that have been basically in the hospital for a year or longer. So you get to know your patients, their struggles, and their inner feelings about what's going on with them.
Yeah, the longer I've stayed with the patient, stayed with the team, the more connection you make. What I found too is even with the shorter time frames, the connection is still very rich and deep. And I can honestly say some of the patients' family members and I are still very close. We have lunch, we go to each other's family events, we celebrate holidays together. And so that to me is just the icing on the cake to be able to impact someone's life to the point where you foster these beautiful, long lasting, and healthy relationships far beyond the time where the patient has passed away.
Did you ever get COVID yourself?
I have had it now 3 times. I had it twice during the initial pandemic prior to the vaccines, and I was off for 3 weeks both times. Very, very ill. And that second time I was actually in the hospital very briefly as well. I know people think, oh my goodness, there's no way this can happen to you 3 times. Well, here we are living the dream. First time was very early on in the pandemic, and really employers were not ready. We did not have the proper gear to protect ourselves. We didn't know if disposable gowns were enough, what type of masks everyone was supposed to wear. We were learning together, all of the world trying to figure it out. And by the time they got us properly prepared, we had mostly all have been exposed. And so there was no employees where I was working that didn't get sick at one point in time or another with COVID. So it's just sad and frightening, but at the same time, very eye-opening.
Wow. So you got COVID a third time?
Yeah, very recently, actually, unfortunately, last week, about 3 to 5 days of feeling moderately lousy. No severe symptoms, respiratory symptoms. So I'm assuming it was probably more of an Omicron variant, which seems to be our newest friend in the alphabetical cycle of COVID, but much more mild than the initial 2 bouts of COVID.
I went to work one day and I had no symptoms per se of what most people think COVID is. I mean, I didn't lose my taste. I didn't lose my smell. The only thing that bothered me was that I had a headache and, we wore masks all day. So, I had some shortness of breath. I checked my oxygen and I made the mistake of telling a nurse. They say they saved my life. I agree to that. But my oxygen, was in the 60s, and that earned me a ride to the ER, which earned me a rapid COVID test, which gave me a 10 plus day stay in my hospital. I didn't realize, how sick I was until I was reading some of the doctor's notes and stuff. And where it said, the prognosis says grave and all that kind of stuff. So when I talk to patients like the patients that I take care of, I can honestly say I know what it feels like. Being in a room where the door is closed for like 10 plus days, you lose track of time. And after a while, it all looks the same. I can say what it feels like to be on a BiPAP. That's scary because you go from, just being on a nasal cannula oxygen with high numbers when that's not working for you to keep your oxygen maintained. So then you go to where you're on a OptiFlow, which prior to this epidemic, I probably had never seen. It's like 60 liters. That's as high as that machine goes. So when we go to the BiPAP, which uses pressure to really help you, so it's not working as hard. But if you're claustrophobic, it's a little hard. The BiPAP covers your face fully. You have to keep telling yourself that it's the best thing for me. to help me get over that hump I'm at. It was the last step for me because I said, I don't want to be intubated. You see people that are intubated and they are on that for so long. And there's a lot of things that go into when you're intubated, you're tube fed. I see people, the after effects, and in my mind, I don't want to do that. I mean, there could be some cognitive issues. There could be some physical issues afterwards. What's the limit of how long I can stay intubated? Who makes that decision? I mean, I did have protocols because I've been in the hospital before. I made sure I have a power of attorney, So I picked someone that's going to speak up for me and make sure that my beliefs and my wants are enforced. That's the biggest thing I can tell people, is make sure you know who you are making your power of attorney, and make sure that you're able and willing to do, make sure they're able and willing to do what you want them to do.
In February, we started hearing about this new illness that was happening in China, and the rumblings from the whole healthcare system was, this is something that we really need to worry about. They told me I would be staying more inpatient the same week that I felt really sick. And I don't know what I had because we weren't testing for COVID at that time, but I did lose my sense of smell and my sense of taste. So could I have had it? Maybe. I don't know. But then looking back, I thought, could I have had whatever this nonsense is that's coming?
Yeah. And have you had any, if you don't mind my asking, if you had any like long-term effects, like long COVID type symptoms?
I think for me, it's memory, remembering things. I mean, I always had good memory, but I find myself writing down a lot. And at first, I just kind of, like blew it off. And then I did mention it to my doctor, and my doctor happened to have COVID the same time. He goes, "Yeah, you too?" Yeah, so it's not just my imagination. I don't know what the long-term effects, on my heart is, on my lungs is, until something happens. So you're just kind of waiting for the other shoe to drop. I hope nothing, but nobody will know the long-term effects because it hasn't been studied. So that's the scariest part, the not knowing.
I still currently have shortness of breath, and I have to use an inhaler, and I had it months ago. I'm speaking very clearly and not stopping to, it's occasional, but I feel like in the long run, I only had the worst of COVID for 2 days. Do I credit that a bit to the vaccine? The science part of me wants to. My husband is not vaccinated. He got it as well, and he was out feeling dead for 10 days, and we had it at the same time. I feel like I probably got it from him because I'm not wearing a mask at home. And yeah, so that's the part of me that wants to say, sure, I had less symptoms because I am vaccinated, because I had that little comparison that we probably obviously had the same strain at the same time.
But so, did you have a routine for, I mean, did you change your routine when you were working in the context of COVID?
I feel like since I've had it myself and I've had 2 vaccines and a booster, it doesn't bother me as much now as maybe a year ago. There's a fine line because every time you leave the room, you have to take all that PPE off. And then you have to put on new stuff when you want to go back in the room. So you want to try and group all of your care in these chunks so you're not constantly in and out. You'll also notice, like, I've only got 1 gown left. So we've definitely run into that before. And you're trying to call people and we need more gowns up here, and nobody shows up for a couple of hours. And I feel like we've been so inundated with emails during this time. There's like constant policy changes. You get hundreds of emails every week. It's too much. It's just too much.
Yeah. I think I saw my colleagues struggle with death. We just saw so much death. And my background in hospice, that's what I did. I saw that. I was there, I was present. And I think it could kind of be similar to, and I've never been in war, but I think you can compare it though, because a soldier prepares and they have a certain goal and they have a certain mission, and death happens along the way. Depending on the mission, it can be a lot more death than expected. And I think that's kind of what happened. Our healthcare system is generally thought of as a place where you go get better. That's their goal, right? They want you to get better. And so to have so much death is what was really, really hard. Certainly not everybody did die, but it just felt like we couldn't do anything. And I know I heard a lot of them say, I lost another one. And I would try to reframe it and say, you didn't lose anybody. You did your best. You did your damnedest. You did everything you could do. You came here on your day off because you knew this person was dying. We would have staff who would come in on their days off because they were so connected with people who were dying. So many tears, so much crying. I mean, the staff were heartbroken. Every patient that they lost. I think it was, and I'm not a mental health professional, so I can't diagnose anybody, but I think that what we saw was equivalent to PTSD, very frankly.
Did you ever have to bend the rules for the good of your patients?
Well, I'm guilty, and lots of nurses are guilty of going to the vending machines and spending our own money to get them the Gatorade that they want, or a bag of chips, or whatever it is that they're hoping for.
Yeah, little special things that somebody loved or wanted to make their hospital stay be a little bit better. When one patient really wanted Philadelphia cream cheese and Ritz crackers, that's what we got. Other people love chocolate chip cookies, or patients who have birthdays in the hospital, we try to do something to kind of honor that. So there's lots of joy and smiles, regardless of all the other difficult things.
With COVID, our hospital has no visitors allowed. Sometimes if they are deemed as critical or they're not going to recover, I know my hospital does make exceptions to have family members come in and see the patient, because, sometimes they may look like they're taking a turn for the worse. Sometimes they just need family. It's nice to talk to them on the phone, but sometimes seeing your family can kind of give them that push that they need to put forth a little more effort. And sometimes it's just being there with the patient, holding their hand at the end, because my thing is, I wouldn't want my parents to be there, and nobody be there with them.
Mhm. And have there ever been times when you've had to fight against the system in order to get patients the dignity that they needed?
Yeah, we go back to the criteria that Medicare sets now for somebody being inpatient appropriate for hospice. And it really comes down to two questions. It's just very basic. Is the patient having any uncontrolled pain or symptoms? And what are we doing for that patient here at the hospital that we can't do for them at home or in a facility? And there are times where they don't meet the criteria, but I can't send them home either. I can't, with a clear conscience or having any empathy or ethics at all, send them home. I remember very specifically an elderly gentleman who came in and he had a disabled wife and he was caring for her. And now he has COVID and they had weaned his oxygen demand down, but he was still going to need a high amount of oxygen when he went home. One of my colleagues had seen him and said, well, he can go home with that amount of oxygen. But when I went in and I looked at him, I'm like, we cannot ethically send him home. His wife cannot take care of him. And so sometimes you have to push the boundaries, and sometimes, you just have to do the right thing and not what's written down in the guidelines or the criteria. So what do I need to do to make it look good on paper?
Yeah, paperwork.
Yeah, sometimes it's a good thing because you can justify on paper what might not be the true criteria. So
Right. And then you can look at yourself in the face the next morning, right? As opposed to, you know,
I can tell the wife when I'm calling her, this is what's going on now. And then, yeah, I can talk to her a little bit more comfortably instead of saying, we don't have a choice, you have to take him home. That's not the right thing to do.
Right. Right. And I guess it would probably be distressing if there's a time where the beds are just full too. Like there are people waiting and yet you can't. This is not a process you can rush, right? I mean, this is just something that happens as it happens.
Right. We did have one incident at the beginning when I first started going into the hospital. I would hear a lot from the doctors, well, we need to get them out. We need that bed. No, you don't. You may need the bed, but this person still has a right to die comfortably. And I'm never going to put a patient in an ambulance. This is a crappy enough situation as it is. I'm not going to put him in an ambulance to die. So once you start sharing your humanity and your empathy with the medical team, then it kind of jolts them back into, that's right, let's all be human here. So sometimes, that's what being a nurse is about. It's advocating for your patient. During COVID and during this pandemic, it's been so easy to lose sight of what our mission is as healthcare providers. And I think that's where the teamwork comes in. We have to be able to say, stop, and look at each other in the eye and say, I'm here for you. I need you to be here with me. We have to remain human and we have to stay focused.
Yeah, a couple of months ago, I had a patient. It was a known fetal demise, which is what we call it when the baby passes away before it has even been born. She was 41 weeks pregnant. This was a full-term baby that she was going to be laboring and delivering. And she delivered on my shift, and this was her fourth baby. She had 3 kids that had gone to sleep that night, and grandma had to come over and take care of them, and they had no idea what happened throughout the night. And they were going to wake up, and she told me that I don't want them to find out over the phone that their sister is gone. So I worked really hard, and I spoke to probably 10 different people that morning to sneak her 4, 6, and 3-year-old child into the hospital so they could come meet and say goodbye to their little sister. I guess even in all of the chaos and all of the rules, there's always room for humanity. There's no reason, in my personal opinion, that we can't be accommodating in the worst of situations. I know in my hospital in particular, even if they haven't been able to have visitors in the ICU, we make those exceptions. And I know that not everybody has been that lucky. Not everyone has been able to say goodbye to their loved ones.
well, I really appreciate you telling us that. That's obviously a really tough story, and I want to say just thank you for doing that for that family and keeping your humanity front and center. I bet they were so grateful to you for the way you advocated for them.
There were times where we would make efforts to move patients close to windows, right to the bare screen, even when it was a little bit chilly. And we could allow patients and their loved ones to at least touch hands through windows, to let loved ones speak words of truth and love and affirmation. We couldn't let anyone in the community because of the rules. But there was an instance where I really spoke with the powers that be, and I said, listen, this is a very special circumstance. I got to know the family very well, and it was a very strange estranged relationship that they had for a long time before the parent became ill. And I said, I do know, historically speaking, it's going to be very detrimental for this child not to be able to say goodbye to their parent. And so I worked with corporate at the time, and I said, if you're concerned about liability, which is, I hate to say it, and it's a sad situation in healthcare, but a lot of this is about liability. And so I worked with corporate, and they did draw up documentation, and they had the family members sign, and I was able to slip them in right into their parents' room. And it was very emotional, very beautiful. But shortly thereafter, after they had spoken their piece, the parent passed away very peacefully. So peacefully that we were a little bit stunned that it had happened in that manner, because there was no angst, there was no trouble, there was no physical looking distress. It was quite peaceful. And I think that made all the difference for that adult child to be able to come in and to pour out that love, to say goodbye, to make their peace. I still stay in touch. I'm reminded often through cards, letters, and notes. You know, I made a way. And sometimes you have to bend those rules and you have to find a way around. I'm not saying purposely violate safety regulations. We shouldn't do that. But if there is a way, make a way.
Right. Yeah, no. Is there some kind of image in your mind? Is there something iconic for you from this experience that you've been through? You know, what would sum up kind of maybe the heartbreak, but maybe also the hope?
I think so. I took care of a patient who had acquired COVID, and her family member lived overseas. So there was not, as you may recall, for a while, there was some travel bans and nobody was moving, and there was no way for the patient's daughter to get back here stateside to be with her mom during this time. And so I would spend a long time on FaceTime calls, obviously at all kinds of odd hours, to try to mend the time difference between the two places. And the patient's daughter was a woman of great faith, very spiritually strong. And even in her brokenness, I drew great strength from the way she spoke to her mother at the time. This went on for about 10 days before the patient had passed away, every day. And the way she spoke to her mother, who could not outwardly respond in any way, was so beautiful and so full of purpose, and just stretched in faith and love, that I was just so inspired to know that we can still connect with one another even when we're not in person, because we went so long without being able to just embrace one another, you know, a simple handshake, you know, hands held in prayer, a hug. There's a lot of brokenness and there's a lot of heartache, but to have gratitude for the time where you can actually be physically in the same place just brought the beauty back into the brokenness.
You know, another note to add to this, in 2018, my brother and my 27-year-old son both died in hospice on our hospice. And so October of 2018, my son passed away, and it was not the peaceful death that we had hoped for, you know. So in 2019, there was that period of time where I thought, I'm not sure if hospice is for me right now. But I never left it. As far as my brother, I was his POA and he had cancer. So I knew it was time to pull hospice in. And so it was very easy for me to have the conversation with him. He admitted to a nursing home, so we didn't have to give that one-on-one care. I was there the whole weekend with him. So I sat back and tried to be a sister, you know, and not the hospice nurse. And emotionally, that was the only way I could deal with it, because I was dealing with my son at the time. And 7 months later, again, we knew it was a time for hospice, and it was a conversation that I had with my son. And however, he was 27, he was making his own decisions, and this kid had been through cancer so many times before. He knew his body, he knew what was going on. So he made it easy for me. He knew the right time. So I stayed with him 24 hours a day. But again, yeah, it was hard. Been saying sometimes, you know, too much. but for me, that was a blessing. I inherited my son's dog, so we spent a lot of time outside and learning to take care of a dog, which I had never had a dog before, and I never wanted one, and I don't want one again. But 2019 just gave me time to kind of regroup and look at my job a little bit differently than what I had done maybe 2 years before, because I'm a caregiver by nature. And when you go through something like my brother and my son, you go through what they call caregiver fatigue. And it was very hard for me. You know, I'm one of those people that helps the church people, helps friends in the community. I'm always the first to volunteer, but I had a very difficult time doing that after he died. And I worried about myself because, oh, I'm just losing that caregiver part of me. That's who I am. But then COVID hit, and it gave me the opportunity to refocus the care on somebody else. And it certainly gave me an opportunity to look at hospice care a little bit differently than what I had done. I was able to handle it, I think, a little bit better than what I would have done if I had not gone through it with my son.
Wow. I'm terribly sorry for your loss. Well, both those losses in such a short time. I can't even imagine.
The other sort of dichotomy that I experienced in 2020, I was pregnant in October, November, and then talking to people about their death when you have life moving around in your belly is such a bizarre, amazing miracle. But then I lost that baby in December. I was at work when I started to miscarry because I didn't want to sit at home and wait, because that was more stressful. I was actually in with a patient when I felt a gush of blood, and I thought, oh no. I rolled to the door to open it up and let them out, and then shut the door. And when I stood up, there was blood all over my chair. Because it was in the middle of COVID, I called my provider and told her I was bleeding quite a lot and had profound pain. They encouraged me to go to the hospital, but because of COVID, my husband wasn't allowed in. I told the hospital staff, this is not the hospital that I work at, but I told the hospital staff that I was losing my baby. Sorry. They just left me alone in the room, and there were 10 people in and out of the room because I counted them. I wrote a letter of complaint to that emergency department afterwards because I had no one until the end of my visit who was compassionate with me. I told them over and over, I said, I work in healthcare, I'm losing my baby, and I'm alone, and my husband's outside. Can you please come in? I mean, he was in the parking lot. Again, people were just business as usual. I know that the pandemic was exhausting, so I was trying not to take it personally, but it was so sad that no one could offer me compassion when I was losing my baby. And I could have had my husband with me because I knew the visitor rules, but no one would advocate for me, even though I asked them, and I was doubled over in pain, so I couldn't even advocate very well for myself. No one was compassionate with me, and because about 6 or 7 people were in and out of my room, I went into the bathroom and caught my little baby myself because she was tiny. She was still in the sack because I was only about 8 or 9 weeks along. But because no one had been connecting with me or cultivating interest, I went back in that room and I wrapped that little baby in a bunch of tissue paper and some gloves and just tucked her in my backpack. And then the nurses came back in and they said, well, your contractions seem less now. And I said, yeah, I went to the bathroom and passed some tissue, but I I didn't tell them anything else because I didn't trust them, I guess. I don't know. I just felt awful. It just felt horrible. It was like I was in this black hole all by myself, and I could see people at the top of the black hole. I knew people should come down in the black hole with me, but no one did. Unfortunately, the way that it was set up, the provider just popped his head in and said, "Hi, I'll be right back with you. We have to do a pelvic exam and all that other stuff, so I'll be right back." I didn't know that this provider would ultimately turn into the compassionate person who would spend time with me at the end. But the problem was I was there for 3 hours. For the first 2 hours, to not have anybody to really connect or offer kindness or compassion really made me feel like I couldn't trust the system generally. The insult to injury, looking back on it, was ridiculous. It was as if someone had written it for a sitcom because it was so ridiculous. Until the very end, when the provider sat down with me and I said, "Look, I should have had someone in here," the response was, "Yeah, you should have." This provider really listened, and I'm grateful for them, and I'm grateful that they are in healthcare because hopefully they treat other people with the same kindness and compassion. But at that point, it was almost too little too late. It was after a few hours, and it should have been right away. It was just this profoundly headache, nightmare, horrible situation that I had endured. I took a day or two off, but we were seeing so many patients. I couldn't really be gone from work for too long. I didn't want to be either. There's a great distraction that can be helpful when you're having so much pain. That also was a very difficult experience for me because I was not allowed. Supposedly, there's these exceptions for me or for people that are in end of life and for a laboring mom. Nobody listened to what I was requesting, and I did not have that support that I should have had. That was tough. That also gave me a big insight into how profoundly isolated and lonely these poor patients are if they're still cognizant in dealing with this and scared, right? I wanted someone just to be with me in that sadness. Unfortunately, the healthcare system didn't meet my expectations at that point. Not even the bare minimum, quite frankly. I have always striven to be present, to be a support to my patients. But going forward after that, I even doubled down. If a patient said they loved gardening and some flowers would make their day better, guess what? I showed up the next day at the patient's bedside with flowers from my garden. If they said, "Gosh, I love Butterfingers," if they were allowed to eat it in their healthcare plan, then guess what? I went out of my way and went and got those Butterfingers.
First, let me say thank you for sharing that very difficult story with us.
Yeah, sorry.
No, don't be.
I wasn't sure if I was going to share that. There it was. So,
Well, I appreciate it, and I can't imagine how difficult it was for you. I mean, your story epitomizes sort of the degree of dehumanization that the medical system is on a good day, and now even worse in COVID.
yeah, we see that. I mean, we knew that this wave was coming because that's how viral infections work, right? We know that they get worse in wintertime, and it's a problem because these caregivers are so exhausted, so tired from the last 2 years. A lot of healthcare workers and caregivers don't want to go out in the field, and we already have deficiencies. We already didn't have enough staff for a lot of different areas, and that's going to cause even more problems going forward.
Exactly. I'm going to use one example, and this to me has probably been one of the hardest for me personally and professionally, in that we live in a small community and we have a nursing home locally. And I've lived in this area all my life. I grew up with some of these people that are at the nursing home. They attended our church. I went to school with their kids. You know, I know these people. And at the beginning of the pandemic, their administration was very callous and basically refused to follow the guidelines. They thought this was the flu, so they didn't initiate PPE and they didn't encourage their staff on the proper techniques. And these issues started way before the pandemic. Let me be very clear there. Now, these people, they're dying. And I think there were multiple people that died before they even decided to start testing the nursing homes for COVID. And several patients or other residents have already died. There was one family in particular that I will forever remember, and it was someone that I was raised with. Their mom had been at the nursing home for several years, and she was very active at that nursing home, and she contracted COVID, came to the hospital, and when she got there, she was on a low oxygen demand, but she felt like she was suffocating. So her demand kept rising, and of course, her family couldn't see her, so the doctors and everybody's talking to them on the phone. It's very hard when you have multiple children to get them all together to hear what's going on. So they depended on me because they trusted me to help decipher what was going on. So I took the iPad in total garb and mask and put their mom on the iPad. And she was very clear in saying, I don't want anything. I don't want to be intubated. And she's struggling to breathe. I want to die. And here are her kids who 3 or 4 days ago just saw her through a window and she was doing just fine, waving and everything. And now she's saying, just let me die, let me die. They cannot give her any support. They are really like, what in the heck just happened? And 5 hours later, she's gone. She's dead. And she was not the only case. She didn't have to die. She did not have to die because somebody didn't want to put a mask on her. Somebody didn't want to wash their hands. To me, that is going to be a long-term effect in our healthcare system. How do we move forward from that? Now that same staff at the same nursing home, they're testing positive again. They're going through it all again. And we have learned, have we learned a lesson? I don't know. You know, a lot of that just back to the basic nursing practice. Wash your hand. Don't go from one resident to another without washing your hands and without doing the proper technique. That particular nursing home had 19 deaths. I had 17 of their patients on my hospice service within a month. And it was hard. I knew a lot of those people. I knew a lot of their families, and it was just hard for a whole medical team.
Moms that have COVID typically have placenta issues, which decrease the blood flow to baby during labor and delivery process. So we've seen a spike in C-sections because of that. Generally speaking, if baby's not getting enough oxygen during labor, when mom is contracting, just naturally speaking, baby's oxygen level goes down because your breath, and that decreases the oxygen already. And if your placenta is not being efficient anyway, it's just kind of this trickle down effect. Blood clots. That's one of the things that has been an issue, which is also in that long run, just decreasing the blood flow to the baby. It's happened, and we've seen it a lot on our floor in particular. We've had moms before and after delivery that have ended up in the ICU as well. I've only heard of one infant death because the COVID was transmitted either during labor and delivery process or postpartum because of the breastfeeding. But the baby did pass away on like day 10. And I feel like that's definitely one of the downsides to OBGYN care is, generally speaking, once mom gets discharged from the hospital, unless there are other complications, they don't really see them again until 6 weeks postpartum. A lot can happen in that time, especially if she has COVID.
Yeah, I recall a particular shift where I had two patients who were very quick transitioning in rooms right next to each other. And one patient had no family, one patient had family. And so I was just running, running in between both rooms, making sure that I could make them as comfortable as possible. Because at one point, you are aware as nurses, you most likely are at the point of no return. So we're doing everything we can as hospice nurses to make them comfortable and just be present. And I recall just such a I just felt like my soul was kind of torn in half, trying to be in two places at once. And then I got a call from one of our chaplains, and he said, listen, I just felt like led to call you. I feel like you need something. And I said, yeah, I need another body in here. I need someone else to carry this load with me, because I can't physically be in these two places at once. And the need is great in both places. And he was walking into a COVID environment. We all knew that when we walked into these patient care settings, we knew that not only could we get sick, but we could bring this illness home. But he came and showed up and stayed for hours and hours. And we were able to transition these patients very peacefully with great comfort and care together until they passed away. And that was tremendous for me. Only to get back out into the parking lot, I can't even tell you. I think it was about midnight to start the car up. I peel off my mask. They were very, very tight masks, and it literally, sheds skin from around your nose and your eyes. It's pretty painful, but not compared to how people were suffering. I sighed, I shed some tears, and I felt like I needed to cry further, but just felt empty at the same time. And then the phone rang, and the charge nurse said, well, you gotta come back in. We just checked on so-and-so, and they passed. And I sat there for a minute, and I thought, this is not happening. It's not humanly comprehensible. How do we keep going? How does this keep happening? What can we do? And the long and short of it is, I donned my whole guard back on. I walked back in and pronounced that patient, and it's just, it was such a well of emotion, because, while running between two, thinking the third was remotely stable, and they were when I walked out, and to come in around 10 minutes later and have them pass and know that happened alone was very gutting to me. So it's a time I hope we never have to return to, but the reality is we're still living it.
This is, obviously, it's hard for us to even take in or process what you're saying, but I really appreciate you telling us this and helping us to understand just the scope and magnitude of the enemy, I guess. I'd like to ask, what is it that you've been able to lean on in this time in order to get through this on a personal and also on a professional level?
Absolutely. For me personally, it was faith. It was my faith in God at the end of the day. And without that, I'm 110% sure I would have not been able to return for one more minute. I would have left, come home, and probably just quit, because I didn't have it within myself. There was nothing humanly possible within myself that I could propel myself into the same situation day after day to continue to fight without my own faith. Prayer was the biggest part of my ministry during COVID, for sure. And at the bedside, in my car, wherever I could, praying with the patients, praying for the patients, the communities, the families, the world at large, everyone that was impacted. So for me, that was my biggest support system.
I feel like there are also, in particular, people on our floor that are just really good about asking if you need a moment. I have one. It's a charge nurse. She's essentially a shift supervisor. We had an issue, and she just put her hand on my back because I'm sitting there at the computer and tears are sort of falling down my face. And I, she just puts her hand on my back and she's like, why don't you just go up to the desk for a few minutes? I'm going to finish up your charting and then we'll meet up. And there's always those people that just recognize it. It's our job as nurses to recognize these things, but sometimes we ignore it in ourselves and in our coworkers.
Yeah, faced with this kind of stress, what is it that you do to unwind? Do you have hobbies or family time? Or is it really the work itself that really keeps you going? Or is it a little bit of both?
Yeah, I think it's a little bit of both, getting home, changing my clothes, taking the dog out for a walk, just kind of regrouping. I'll have to be honest, is that I didn't really rely on a lot of friends and family and even colleagues because everybody has an opinion. And at the end of the day, I just don't want to hear anybody else's opinion about it. If you want to just listen to me talk, that's okay. But don't listen to me talk and then give me your opinion because I can't deal with that right now. I think, a lot of prayer, a lot, and just trying to stay grounded.
I color, adult color. I watch a lot of TV when I go home. I try not to think about work. You heard people say, don't take your work home, and I try not to. But there are just some patients, you can't use a name, but you talk to your spouse, this patient said this to me and we talked about this and that. But you try not to take home what you see at work. Yeah, if not, then you'll spend all the time. I'm on antidepressants too. I think everybody is on it to some degree. I got on antidepressants after I had COVID because it's just sad, I was sad, and I didn't like being sad. So I talked to my doctor and I took care of it.
When I come home, I don't really get to have any downtime between shifts. On my days off, if I did not go to the gym, I would probably lose my marbles for sure. That is my outlet, physical activity, getting a good sweat, or maybe just yoga or something that takes me away from that seriousness. I do have a grandson now. He's a year and a half old and they live with us currently, but he's been a joy to have around. And I come home from work and a little time with him is all I need.
I really, for the first time in my entire nursing career, had to really put a foot down and say, these are my boundaries. This is all I am emotionally and physically capable of doing, which was very hard for me because I'm one that does not care for the word no when it comes to helping other people. I want to step into that role and give it everything I've got. And I felt like I was capable of so much. And then this really has tested those waters and really taught me to open my eyes and my mouth and advocate for myself in a way that I've never had to before.
Yeah. And I work in a field where everyone who I see is going to die at some point. So what I usually do is I light a candle. I have a battery operated candle. If it's an especially difficult case, I leave the candle on for a few days and I'll just put on the candle and whisper a positive experience that I had with the patient or the family into the air and imagine them going to a good place. I had to figure out a way to cope. with it, because at first it is overwhelming. And depending on your background and your religion, your personal beliefs, it can be exhausting. Everything feels like it's very uncontrollable, and scary and exhausting. For some reason in my life, I feel like if I can help those around me, then I could cope better.
Well, my best friend is actually a midwife. So I talk to her and she definitely supports me, and sometimes I can support her too. I'm a talk it out kind of person, and as much as we want to be able to rely on our spouse or family to get us through these situations, I can tell you almost everyone I know that's in healthcare needs someone that understands those moments, that have walked those roads. Sure, I tell my husband I had a bad day, this is what happened. It's hard not to take that home. I feel like I want to be able to grieve those losses with my patients. I just never want to be so callous in my care for another human that I'm just, yeah, the baby died today, or the mom died, but no worries. I try and journal too. I try to talk to my friends that have been there also, but they still just kind of hang out in the back of my mind sometimes.
Yeah. Does your facility help with mental health? Or what other things have they done to reduce, staffing shortages?
They have increased some of our pay for retention. It's like a thank you, we appreciate you. They reassess our pay and stuff like that. They're offering a lot of bonuses to get people to sign up to work extra shifts. They're like, double bonusing it. I mean, I can honestly say they are putting forth an effort to try to make sure that their employees are happy, to make sure that, we get some self-care time, but it's not really enough.
Yeah, unfortunately, those needs are not being met. Unfortunately, for instance, during the pandemic, our organization has an employee assistance program where you can reach out and get some counseling, and it's free of charge. And they had a huge waiting list. It was not a benefit. And then you have your managers and your administrators who are just so overwhelmed with staffing and getting the beds and all the busy work is what I like to call it. They don't really see what we see. They don't really see what the nurses or the respiratory therapists or whomever is going through. And I'm a little salty about it. When I was working all those hours and asking for help, can somebody come help me or whatever? I didn't get any help from, not one of our coordinators drove down to help. Not one of our managers helped with call. The director didn't help with call. And I see that in the hospital as well. They're so understaffed and so overwhelmed. The morale is absolutely zero. And you have these managers that come up and say, "Hey, how you doing?" And the nurses are like, "I'm awful. I can't keep this up." "Okay, well, let me know if you need something." And they're gone. You don't see any of them putting their scrubs on and taking a team. And I know they can't do that every day. They have their jobs to do it, and they can't. But can somebody just sit and answer the phone while you do your computer work? Can somebody help put an order in? I feel like the only people that can relate are the nurses and the inner staff. When I first started nursing, there was a divide. We had the doctors who were up on a pedestal and the nurses that were down here. And then you had the ancillary staff that were considered kind of like below the nurses. And that's what the attitude was. I can say thankfully that a lot has changed since then. Cafeteria workers, respiratory therapists, maintenance, whomever that is, and the nurses were all together on the same team, which is the way it should have always been. Nobody's above the other person. We just have different roles.
We have lost a lot of our full-time staff over, I would say, the last 6 months. In my facility, a lot of people felt like it wasn't handled very well by management. I know that the nursing staff in particular did not feel supported by management. Things would get so hairy. We didn't have enough people on the floor, and yet they would sit in the office instead of coming to help. Because I mean, even our managers, our nurses that are trained in our department, we have travelers coming in, and the travelers tend to get treated poorly. Maybe not in our department, but I hear in other hospitals they do. When people say, if you would just staff appropriately and pay the people well, who would have been here through the thick of it, perhaps you can retain the employee that you had in the first place. None of those things happened. Hospitals are offering large bonuses and better pay to those just coming in. It's a slap in the face. Everyone I know that worked in a hospital got zero incentive for working harder, working with less resources, putting our lives on the line, literally breathing the air of COVID patients. And they give us a pizza party or a thank you card that wasn't even personalized. It's literally just the printed thank you and your boss's signature on the inside. That doesn't really feel like a heartfelt thank you for your service.
My organization has been really good to us. They're doing the best to make things as fair and tolerable as they can. During last year, like the first big year of COVID, they did pay for our sick time. Currently, there are those of us working extra shifts if we choose to do this. They're basically utilizing their in-house staff as travel nurses, float nurses. You sign a contract for 13 weeks, like a travel nurse might, and they pay you $60 an hour on top of your hourly rate. And then at the end of the 13 weeks, you get a bonus. So you're working the extra hours anyway. You might as well sign up. You might as well sign the contract and get the extra out of it.
Right. Did you sign up for that program?
I did, partly because my husband lost his job in April and he's only working part-time currently. So I need to make the extra money while it's there, just to keep us afloat. So it's been helpful for me, but I am tired. I kind of just want to work my regular hours and be done with it.
I mean, yeah, I follow things on Facebook, different travel nurse pages, and there are places in Texas that I saw a 13-week contract, and you could get $43,000 for a labor and delivery nurse. I could leave for 13 weeks and I'd be debt-free, pay off my kids' college in just 13 weeks of work. Or I could stay where I'm at and have a pizza party.
Does the hospital offer any kind of like mental health assistance or anything like that?
Yes, they do have assistance. They have like a helpline or whatever you can call, and you get like 5 free visits with a counselor if you need somebody to talk to about things. They offer 10-minute massages if you can get on the schedule. A lot of times they're filled up instantly. On my unit, my manager thought she would set up this little quiet corner that has back massagers on the chairs and tea and things like that, but nobody really has time for that. You're not gonna say, I need to go sit in the quiet corner for 10 minutes and massage my back and have a cup of tea. Can you watch my patients? The thought is nice, but it's just not realistic.
Right. So you're literally on your feet, moving around, helping patients literally 12 hours straight.
Yeah, I can't even tell you how many times I've come home and told my husband I didn't eat anything today. And I'm not exaggerating. I have a protein shake in the morning, and 12 hours later, I come home and I can finally go to the bathroom. I can have a drink of water. I can have a sandwich before I just crash on my bed and pass out for however long I can manage to sleep. Then sometimes my stress level is so high, I'm dealing with all this stuff that I'm not even sleeping. So I can't even tell you how many times I've gone to work and I know that I've only gotten 4 hours of sleep. I'm not eating and it just piles up after a while. I feel like it's getting better, but I've had those days and they've been back to back. Like I said, I just don't think it's fair to have those expectations on one person.
As far as my employer goes, not a ton of support. I mean, I think they did what they thought they could do, But to be honest with you, everyone in the office assumed positions from the safety of their own home to run the behind the scenes stuff. So it really just left us frontliners right out in the literal front line of the battlefield, which is, I mean, I have no regrets. That's where we belong. That's what we signed up for. However, I think there was a huge disconnect with people that worked administrative wise versus those of us that were, right in the front line, that were just grew such a distance and lack of true understanding with what we were enduring. And that, I think, was very damaging and detrimental, and eventually led to me resigning from that company that I was working for at the time.
You'd mentioned that sometimes after everything you've seen, it can feel like you're a little jaded sometimes about death. And I wonder if that also goes over into your personal life.
I do feel sometimes disconnected from my real life, I guess. I feel like sometimes it's all about work and then trying to get things done that you need to be done around the house. I do feel like that has suffered. Personal life problems don't go away. It's just, yeah, sometimes I feel it makes it harder for me to be a good communicator at home. Sometimes I just need to disconnect from seriousness. I don't have the reserve and fortitude to keep being so serious for the last couple hours of my day. I feel like I just need to be 100% disconnected from everything because I put all my energy all day into other people.
We've seen people not just leave their current jobs, but they've left nursing, they've left healthcare, they've left the respiratory therapists, have left the speech therapists, have left the physical therapists, have left, ICU nurses, nurse practitioners. They're not just leaving their job, their role, they're leaving healthcare. That's bad. That's very, very bad.
Some of the staffing shortage is that people didn't want to be vaccinated. They felt that it was infringing on their rights to choose, so they decided not to work. I questioned that because prior to me coming to the hospital I work at, I had never taken a flu shot in my life. But again, when I came to be an employee of this hospital, I took it. Did I like it? No. But I took it, it's an expectation of my employment. And people would say, well, you don't exactly know what's in the vaccine. You don't know what's in the flu shot every year, like what's the difference? You don't know what's in that Coke you drink. There's a lot of stuff we put in our bodies and you don't have a clue what's in it.
And a lot of people don't get their flu vaccinations because they've never had the flu. But do you want the flu? The real flu? Probably not. It's pretty miserable. And that's kind of how I wish people would look at this. It is your choice not to get vaccinated, but again, you're the one that's going to be feeling terrible. It's just frustrating that people refuse to do their part in making this less bad. Maybe I feel a little more empathy towards the ones who are afraid of it, of the unknown, putting these chemicals into your body. But even then, I'm just like, if people hadn't taken the chance with the very first vaccination, then people would be dying from smallpox, But people were brave enough and they stood in line to get those vaccinations. They trusted the science way more than they do now, and we know so much more than we did then.
And we still have people that don't believe COVID is real. They come into the hospital, I want to take this, I want to take that. I don't want that drug for, COVID because of the internet. It says it's bad for you. The internet is not trying to save your life. Like trying to convince someone that that's not true at this point, I don't think we can. We have to abide by what patients want. And if they don't want the COVID drug, why did they come to the hospital? You don't want the COVID drug because you've been Googling. That's what I'm calling it, Googling. The internet is great for a lot of things, but it becomes a problem when you're letting the internet dictate what the doctor says.
Yeah, I think that's where a lot of the mistrust of the public came in when we would say, well, they had COVID 6 weeks ago and now they had a stroke and it was a certain type of stroke from the COVID virus. The public was like, oh, everything's COVID now, everything's COVID. They put COVID on my dad's death certificate, but he had a stroke. Well, he had a stroke because it was related to COVID, you know?
Would you say that with this new surge, Omicron, I've heard that it's maybe not quite as deadly. Is it just a milder variant, and or is the vaccine working?
Well, I don't have the exact numbers in front of me, but I think the vaccine is working. We're seeing the vaccine working. We don't have as many people on ventilators. We don't see as many people in the ICU as we did before. The patients that we're seeing that are COVID positive must not have been vaccinated.
Get your vaccinations and boosters, people. Trust that scientists know what they're doing. And I understand people are afraid because things were developed quickly and not necessarily tested as deeply. I just feel like this is our one thing that we know we can do to make this less bad. And I wish people would just do their due diligence for humankind.
Yeah, the experts have shown the vaccines seem to be safe for the majority of people. Overwhelmingly, multiple countries are telling us the same things. It's not just the US government. Let's get our vaccines. Let's keep those around us safe by hand washing and keeping distance if we can and wearing masks if we can.
If you come to see me, you're going to get the same treatment, whether you're vaccinated or not. But I would like for you to make informed decisions, not decisions that you read on the internet or your neighbor told you next door they took the treatment and it didn't work for them.
I was vaccinated early on. As soon as they came out, I felt like that was just a way of solidarity to connect with all of us who survived this. And I was very excited at the time. I think we've just discovered now that the vaccine is not necessarily going to prevent you from getting COVID as the initial hope. I'd like to put some faith in having the sacrifice of getting the vaccine, but it's hard to know. I've now talked to many other colleagues who have been vaccinated and boosted and have had COVID again, and were very, very ill.
Yeah, I mean, there's so much debate, discussion, misinformation, and confusing information. Do you see that playing out in your practice on the personal level, or do you have any feelings about it on the national level?
No, it's a great question. As to the vaccine point, the pros and the cons, political views, religious views, there's so many aspects to explore. The disease itself, the vaccine itself, what are the long-term effects? We're trying to figure out how to staff hospitals, outpatient centers such as hospice, and still try to allow people to have freedom of choice. I'm careful to say it, but there's a little bit of a government or political overreach at times where people feel like we're being told what we have to do. But yet at the same time, if we don't comply, are you employable? Can you go and do your job? And if not, what can you as a nurse do to continue to serve humanity if you're not allowed to come back into healthcare communities if you don't want to be vaccinated? So it's a really tough spot.
Right. So where do you see yourself in the future? Like, are you going to stay in healthcare?
I can't imagine leaving my job, and I have actually considered it because I'm getting older. It's physical and taxing, and I've looked and I'm like, I can't imagine doing anything else. I would be bored.
Actually, I will be starting working as a rehab wound nurse in a rehab hospital. And it was a decision that I struggled with. I've been doing this a long time. I did pray on it a lot, and there were times like a lot of tears were shed, and I tried to come up with a compromise, but it wasn't there. So then the more I prayed on it, that's when I thought, well, maybe, God's just refocusing. Maybe he needs me somewhere else. And so that's the direction I'm going.
So professionally, you're going to maybe slow down a little bit and be able to kind of leave your work at work.
Right. Yeah. I think I just need to change my direction of care. I think right now I'm just kind of refocusing on the type of care for myself. Instead of caring for everybody at such an emotional and spiritual level, maybe I need to step back and kind of regroup a little bit, and maybe it'll be temporary. I don't know. I'm not sure yet.
Do you feel it was that treatment at the hands of the company that you were working for that finally made you resign?
Yeah, I think that was a large part of it. Definitely, I will not downplay the grief. I think I'm definitely healthier after moving on to a different company, a different area of work as well. It's been a very healthy move for me. I have something, and that's an ongoing healing process called compassion fatigue. I was not aware that it was something that I was suffering from until it was pointed out to me. And compassion fatigue is basically taking on physically, emotionally, spiritually, intellectually the trauma of another person as your own. So almost having a lack of ability to disconnect or come apart from someone else's trauma as you embody it as a part of you, part of what you do, part of who you are. And I mean, everyone has heard of burnout. That's more common, but compassion fatigue is on a different level where you keep going and you keep doing what you're doing, but you are driven by connection where you cannot disconnect from someone else's trauma. And sure enough, that definitely was the entire epitome of what I was doing as a nurse, and became so connected, so involved, unable to unplug, not sure how to do that. And that is still to this day taking some undoing to correct.
I'm wondering, was it tough to let go of all those old patterns? Was that difficult?
Tremendously difficult. When this burden became so tremendous, I shifted gears into education, moving from full-time hospice to a nurse educator. But my nursing students, I have met some of the most incredible young people, and I am so very hopeful for the future of nursing. Being back into a patient care setting where we are hands-on, it was an adjustment. I found myself very much wanting to just become one of my students and jump right back in and do all that patient care and be responsible for the well-being of others. And it was a little bit tough to let them take the lead. And that took a little bit of restraint because the bigger part of my working career had always been bedside, but it also allowed me to speak into their lives in such a beautiful way. And that was a huge part of letting go. And at the same time, in the letting go, I was giving. And I think if I had to just unplug, let go and walk away, it would have been much more difficult.
Hmm. So let's imagine a miracle happens and the presidents of local hospitals want to know from frontline nurses, CNAs, doctors, what have we learned about healthcare delivery from COVID? What changes should we make moving forward?
I would wish for better healthcare access just for everyone, but especially mental healthcare access. I hear it from my patients that they've got 6 months to a year before they can get in to see a provider, and that's just insane. Who can wait that long? That's a really long time. Honestly, I would be of the mind to advocate for a healthcare system for all, so everyone has equal access. The ability to not have to incur huge debt or go bankrupt, because I can tell you that a lot of times I heard from my patients, well, just let me die because I can't leave my family with these kinds of loans. I think one thing that's sort of been missing from a lot of the discussions is how can we be kind to those around us? Yeah, it's an extra step for me to do, but it's not that big of a deal in the long run. How can we help people be more kind? You have to be willing to do that. Step into that unknown and try it out and see what happens. COVID is our enemy, not other people.
Yeah, right. If you had that a question of, if you had all the money it took, how would you fix this? How would you change our trajectory from one where we're still getting sick with this disease 2 years later?
Yeah, I don't know. There's got to be a way that we can get the public to trust the medical personnel. And I think one big thing is to get the government out of it. Fauci, he's lost his, nobody trusts him. We need to put somebody else in there. We need to, I don't know who it would be, but somebody from the front lines, somebody that the people will trust. You have the CDC saying one thing, the FDA saying another thing. Like, nobody believes you. How can you encourage somebody to get the vaccine when you're not even giving them the right information? It's easy to talk about the numbers of people that have died, but we just have to put humanity and a human face to that number. We're not just talking about, well, that was number 14 today, but that was somebody's dad, that was somebody's grandpa, that was somebody's brother, And now the other thing is that not everybody has a somebody. We have to be that somebody. That homeless person that got COVID, he didn't have anybody else. We have to be that person for that number 14 or whatever it is.
I'm just thinking about comments and things that I've seen on throughout social media, is that the expectation for healthcare workers is just, you signed up for this, you're the one that went to school for it, so you just have to deal with it now. I think that people are forgetting that we are human. We have families at home that we're trying to care for, just like the teacher or the grocery store worker. I don't understand why people feel like we should be treated less than anyone else. And that there's just an expectation that we constantly put others before ourselves. Why are we not allowed that time to care for ourselves, to care for our families? Then perhaps we would be better nurses or doctors or phlebotomists or even environmental services, just because we're allowed that little bit of humanity.
I've had some nurses lately question, no, this is not what I signed up for. And when they say that, I know that they're saying that because they're burnt out. They just feel tired. I have to hope, I have to pray that if they take a step back, maybe work somewhere else, that zeal and zest for nursing that they found and had, it will come back. I have to believe that. I have to hope that maybe they just need a little time, a way to approach it, and see it a different way, because you do get tired. I know that it's overwhelming. It's scary. And this is not what you thought it would be, but times have changed, and we've had to change with them, or we get left behind.
Actually, I'm so grateful. I am so grateful to have survived that time myself, because then that continues to solidify my purpose that, the future of nursing is alive and well. This time period will pass down the road many years, and the nurses will look back and, I hope just have a glimpse of this versus being in the thick of it. But we'll have learned the tremendous amount, is my hope, to have on hand should something like this happen again, which I hope and pray it does not. I think I would just say to take courage and that this too shall pass. And I do believe that it will. And I think it shall pass, leaving us better human beings, more compassionate, more understanding, more willing to learn, more willing to listen to one another, to truly see one another for who we are, and to really embrace that in one another, regardless of differences. And so just be courageous, keep pushing,